Hey everyone, thanks for joining us today. I'm Dr. Steve Weinrock. I'm a veterinarian and Trupanion's Chief Veterinary and Product Officer. At Trupanion, we provide medical insurance for cats and dogs. Today we'll be discussing all things pet behavior, which is especially relevant with so many of us leaving our pets at home alone and returning back to the office post-COVID. After so much time together at home, this transition has really created some angst, not just for pet parents, but for the people as well. And that means more trips to the family veterinarian. We've actually seen a record number of veterinary behavior visits in 2023 to date. And we've had a ton of behavior questions sent through social media and email from families and veterinary professionals. So we'll tackle many of those today, as many of them as we possibly can, and we'll do our best to answer any questions along the way. So please make sure to post those in the chat for us. Joining me today to discuss all things behavior are three internationally renowned veterinarians with lots of letters behind their names and with serious expertise in neurology, neuroscience, and behavioral science, as well as veterinary medicine. First is my friend, Dr. Carrie Jurney. She's a board-certified specialist in internal medicine with a specialty in neurology. She's the founder and a practicing veterinary neurologist and owner of Remedy Veterinary Specialist in San Francisco. We also have here with us today Dr. Kathy Murphy. Dr. Kathy Murphy is a double doctor. She's a PhD in behavioral neuroscience, and she's a veterinarian. She currently serves as Chief Executive Officer at Behavior Vets in New York. And also we have Dr. Elise Christensen, who's a veterinarian, a board-certified veterinary behaviorist, and an international lecturer and author. She's also Chief Medical Officer at Behavior Vets in New York and works with Dr. Kathy Murphy. We're super excited to cover behavior, including answering any questions submitted directly from Trupanion members. We'll do our best to answer any of these questions you might have in the chat and throughout the premiere. So let's get started.
Hi, everyone. As Dr. Weinrock mentioned, I am Dr. Carrie Jurney. I am a boarded neurologist, which means I exclusively work on the brain and spinal problems of my patients, and I mostly see dogs and cats. So I'm really here to talk about all of the medical reasons that your pet may be acting abnormally. I think, a lot of what we're going to talk about with some of the very smart behaviorists that we have here is kind of the more psychologic, if you will, the more behavioral based issues that your pet may have. But a lot of the times what we find is that there's actually an underlying physical health condition that's triggering all of that. And so, I see actually a lot of patients, 4 patients this week, who really just want to be cleared of all of their medical conditions before we end up going to the behaviorist. So, this is something I do very, very commonly in my practice. And the list of things we can find is actually quite broad, right? Anything from a skin condition to a GI condition, any sorts of chronic pain, and certainly, problems in the neurologic system, like brain problems, can all show up as behavior. And I think we can all understand that, right? I think everybody gets a little grumpy when they're sick, and our pets are no exception, right? And our pets will definitely manifest signs of discomfort, nausea, pain in their behaviors, right? It's usually the first trigger we have to know that something's actually going wrong. So, I think about, for instance, endocrine conditions. We can see some of our pets feel really sluggish, or they can seem disengaged if they have something like hypothyroidism. Alternatively, something like Cushing's disease can cause panting and irritation, agitation. It can actually increase their blood pressure, which is another reason that pets may feel agitated. Cushing's and diabetes can make them need to drink a lot more water and pee a lot more, which a lot of people see as a sign of anxiety. So, that's just one system in the body, right? And just there, we already see how our body systems can impact behavior. Another big thing we always want to look for is pain, right? I think anyone over the age of 40 will tell you that, stuff hurts as you age. And sometimes you injure yourself when you're young too. And so painful diseases like arthritis, right? Sprained muscles, disc disease. It's something I deal with a lot, of the cushions in between your spine. If you're a dog, particularly a small dog, can pop a little bit and actually put pressure on your spine, and that hurts, right? And pain is something that animals, like people, can express very differently, right? Some animals get quiet, some get really anxious. some tremor, some shake, some start having abnormal behaviors like peeing in the house. All of those things can just be a manifestation of pain. And it actually can be quite difficult to tell, just kind of as a pet parent, that your animal's in pain, especially in cats. Cats are particularly good at hiding their pain. So anytime we see a cat with abnormal behavior, looking for pain is something that's really, really important to do. And then, of course, we get to my specialty, which is diseases of the brain, right? Diseases like brain tumors, strokes, infections, autoimmune disease, especially if they're in the front part of your brain, that's the part of our brain that controls our personality, that can definitely lead to behavior changes. And so all of those factors are things that you and your veterinarian are going to work out before we decide that something is a behavioral problem, right? And so as I'm working through this with my clients, we tend to go over a couple of things. So first and foremost, certainly our behavior is also impacted by our environment. So if you've just moved to a new house and all of a sudden your pet is soiling, well, I'm concerned about your house environment and the stress therein. And that speaks to more of a behavior issue to me. But if you're in the same place you've been for a long time, not much has changed, and all of a sudden your pet is acting differently, I worry that's a medical condition first and foremost, right? The other thing is, there are certainly behavioral issues or just behaviors that we expect at certain ages, right? So like, for instance, a puppy, a kitten may not be fully housebroken yet. That's normal, right? We have to learn how to do that. But if all of a sudden your perfectly housebroken pet is not peeing outside where they should or not using a litter box, that is concerning for a medical problem, right? And we want to check in on that. And then the other one that is always a big red flag for me as in terms of neurologic disease is if their response to something is way, way, way too much for whatever triggered that response, right? So I think of a patient who, for instance, now can't be in the room when you're watching TV. This is an 8-year-old dog and it's watched TV with you for the previous 8 years, but now all of a sudden you're just watching a normal show and a sound happens on the television and they freak out and run from the room, right? Like that's really different. And in fact, being hyperreactive like that to noises, to lights, those can be signs of various diseases. Being hyperreactive to lights, for instance, may be a sign of an eye condition. Being hyperreactive to sounds can definitely be a brain condition. So those are things that we're always trying to figure out, as I speak to my pet parents in the exam room, right? And then, we want to think about, their interactions with the environment. A lot of my patients with neurologic disease become afraid of slick surfaces. All of a sudden they won't walk on the tile. They won't walk on the hardwood floors. And that's actually because it's gotten harder for them to do so because the signals between their brain and their foot aren't working as well as they used to be. Maybe when they're on a walk, you hear them scuff their toenails or step weird. That's also a sign of early neurologic disease. So those are all things that we want to pay attention to and go have checked out if we're seeing them. And then, I certainly see some of the more classic signs of brain disease, things like difficulty sleeping through the night. We see a lot of dogs with sundowners, if you will. It's called canine cognitive dysfunction in dogs. It's doggy dementia. And one of the big symptoms of that is actually a disturbance in your sleep-wake cycles, AKA you sleep all day, but you're up all night pacing. And so what I would encourage all pet parents to do is, your pet, your pet better than anyone. And if something's weird, different, don't puzzle that out by yourself. Your veterinary team is here to help you figure out if there's anything that we could be doing to improve your animal's quality of life. That's our whole purpose. That's our whole calling. So that's the bulk of what I have to say. So why don't we go to some of your questions and talk about that? All right, looking here. So first question. How often should families scan for medical symptoms? I think that's a great question, right? Certainly, in my practice, we deal with a lot of very observant, even hyper observant, worried pet mommies and daddies, right? Like that's a lot of the people who showed up at the neurology practice. And I am one of those myself, so I completely understand. But I do think there is a reasonable happy medium between not noticing anything that's going on with your pet and watching them every second of the day and recording their every move, right? So, for me, I think especially when a pet has a chronic disease, it is important to be monitoring symptoms fairly carefully. I would say on average, when we have a pet that we're monitoring a chronic disease, I'm asking my clients to take kind of a weekly index. Sometimes it's more often, but often a weekly index is okay. Like, how many times did my pet, I have one cat that gets a lot of hairballs. He pukes sometimes. If that's happening more than once every other week, that's a little bit of a red flag for me. That's a little bit of a, hey, what's going on with him? Did I switch his cat food? I start thinking about that. I don't think about it every day, but I do try to keep an index of like every week or so. I'd say, and then of course there are some of my patients that are very sick and we do need a day-to-day accounting, but that's something that I, as part of their veterinary team, have discussed with them, and we have a specific plan in place for that. I certainly have seen pet parents that come with a notebook with every single time their dog has urinated, defecated, eaten, drank water for the last 10 years. I mean, kudos to you guys for record keeping, but I'm going to tell you as a clinician, I don't need that much detail. So, happy balance, right? And if you have questions about how often you should be doing that, that is a great conversation to have with your veterinary team. Okay, next question. How can pet owners differentiate between normal pet behavior and behavior that requires professional attention? Great question. And I think there is a lot of room in there for interpretation, right? So I would say this is harder for my clients that this is their first pet, right? Because they don't have a good baseline of what normal is. But for most of us, we're not on our first pet. And so we have some idea of what normal pet behavior is. And then as we get to know our pet over time, we know what their normal behavior is, right? Not every dog, not every cat is the same, right? One of my cats, I would be super worried about him if he wasn't climbing to the top of the bookshelf and screaming at me every day, right? That's his normal behavior. If his brother, Coconut, my little fat ragdoll, was doing that, I would be desperately worried for him, right? Because that's not a normal behavior for him. He is more sitting by the food bowl, just waiting for the moment for me to feed him. That's his normal behavior, right? We can't ascribe one normal to those two animals because they have different behaviors. I think certainly, if you are noticing a big change in your pet's normal, that's a great time to check in. And then I also think there are some basic symptoms that should always trigger a check-in. If you have a sustained, and I mean like more than a day or so, change in appetite, drinking water, if you're seeing symptoms like coughing, sneezing, vomiting, diarrhea, those are all things that are like, yeah, let's go. If you notice your pet's stiff one day, maybe you went on a long hike and they're stiff, okay, that's not a huge red flag. If they're stiff 50% of the times they're getting out of their bed, you notice that, for 10, 20% of the day, they're really uncomfortable. Like, okay, that's starting to impact our day-to-day life. And that's definitely worth a check-in. Okay. And then the final question is, when should a family see their vet to discuss possible medical problems? Well, the shorter answer is whenever you're worried, right? So I would say whenever you're worried, it's a good idea to schedule a recheck exam. I'll tell you, if your pet is experiencing something new, this isn't usually something I can advise you of over the phone. It's something that I usually need to look at your pet and maybe do some lab work. So this is something you're going to need to come in for. So schedule an appointment. And then I think this is another place where routine care is super important, right? If we're having our annual exams, and as we get older, maybe those exams become 2 to 3 times a year, we're seeing our veterinarian more often, they're doing physical exams, and we're catching things earlier before they become big problems. So that is what I would recommend, right? You don't need to call for every little sneeze, but if it's becoming a problem, please just check in and then, make sure you're going routinely. Let us catch things before they're a big deal, because it's way easier to prevent or treat problems early than it is to try to catch up after they're severe. Okay. I don't see any more questions for me. So I'm now going to hand this over to Dr. Murphy. She is a neuroscientist and a veterinarian, and also works with this behavior group. So I think she's going to have some amazing insights. And so Dr. Murphy, take it away.
Hi everyone, I am so grateful to be here with you today. My name is Dr. Kathy Murphy. I'm a veterinarian and I'm also a neuroscientist, and I have the pleasure of working with Dr. Christensen at BVetMed, where I bring to the team my neurobiological take on things. So I'm just going to run through a few points about behavioural health from a kind of neurobiological point of view, with a view to kind of helping to frame what Dr. C is going to be talking about in a little bit. So it's really important when we think about behavioural health to remember that the mind and the body are not separate, but actually are one. So healthy body, healthy mind. And from that point of view, it's really not possible to entirely separate out all the different parts of physical health with canine mental health, for instance, because they're all interdependent. And we realised at Behaviour Vets that one of the themes that was really important for us when working with animals that are having behavioural difficulties is looking at resilience and where that fits in with their lifestyles in terms of how resilient they are to different situations, and whether we can build their resilience to different situations to support their behavioural health. So in terms of being able to make that practical for you guys to be able to utilise, we've created a framework called the Resilience Framework, which looks at 7 different domains of resilience and helps us to be able to use that framework as a structure to create training plans and also behavioural health support plans around those 7 domains. And I'm going to mention some points about those domains in the following topics. So if we think about strategies for preventing behavioural problems, we've got a number of strategies that some of you will be well aware of. So we understand that early life experience is an extremely important part of the brain development and the individual's ability to develop that all-important resilience later in life and stress management. And we often hear the word socialization, so how important socialization is for puppies, and also how important training is. It's really important when we think about these approaches from a brain development point of view that we remember that quality of socialization and quality of training is much more important than quantity of either of those. And particularly when we think about things like identifying potential triggers, so situations or environmental situations that might trigger the individual to be stressed, we can utilize the quality of early socialization and the quality of training in order to essentially give the individual dog more tools in their toolbox. So more different ways that they can learn through training and socialization, those all important social skills and social flexibility that enable them to be resistant to the stresses involved in daily life and those potential triggers in the environment that might trigger a stressful response for them later on. So that's one of the ways in which we can build up prevention for behavioural problems within our pets. Now, in terms of effective training techniques for addressing behavioural problems, at Behaviour Vets, we absolutely are committed to ensuring that each individual animal gets access to kind methods. So things like positive reinforcement training techniques that use toys or food as rewards for the behaviours that we want to develop in the individual. And we avoid situations where they're punished or where they have a negative emotional experience. So it's really all about finding those fun ways to interact with our pets that focus on the good and the rewarding situations and finding those rewards that matter to the individual, whether those are food or a particular toy like a tug toy or a toy, a ball, etc. And some of the research has shown that actually by utilizing those fun techniques rather than focusing on punishing techniques, it actually changes the way that the brain is structured. So it changes the way that the individual neurons are firing together and those different brain areas are communicating with each other. And it can actually make individual dogs more optimistic versus pessimistic. So it's not just a nice thing to do. It's not just about being kind to the individual and not causing any stress or suffering to them, but it's actually about supporting healthy brain development. Now, unfortunately, we do know that some pets can still experience stress and anxiety for a number of different reasons. And the signs of stress and anxiety can look very different depending on the individual dog. But they can look like things like hiding or avoidance of situations, maybe trembling or shaking, maybe stiff muscles, so stiff body postures, or high levels of muscle tone. They could look like subtle movements or positions, such as very erect ear positions, so the ears are pointed right up and very hypervigilant, so with a stiff tail in an upright position, for instance. Or it could look almost the opposite, in that the dog's trying to make themselves smaller, so they're kind of crouching. It could look like growling, snarling, snapping, biting, any of those types of behavior that we would typically refer to as kind of aggressive behaviors or maybe reactive behaviors if we're talking about dogs. Or for cats, it might look like growling or hissing, that kind of classic hissing that cats do, or a change to their vocal types of meows or yowling. So these behaviors can look very different depending on which species we're talking about, but also depending on the individual. And they can be very obvious or very subtle. So it's a really good idea for us as pet parents to be able to observe our animals when they're in those different situations, so that we can kind of train ourselves to be able to pick up on what our pet's body language looks like when they're feeling comfortable, and what our pet's body language feels like when they might be feeling uncomfortable. And here we're talking about that transition back to work and that change in routine for our pets, which is really a challenge to their resilience. That's what we're talking about, is that change in routine being a challenge to what we call the domain of predictability. And that's known to actually change the way that the brain chemicals are being released in the individual's brain and leave them vulnerable to feeling those feelings of stress and anxiety. And so by watching their body language changes, as we see that shift in routine, it can help us to identify whether that individual pet is managing to cope with that shift of us going back to work. So it's really all about us being super observant and being able to watch any changes that are happening for our pets, and to be able to pick up on those subtle behavioral signs that our pet may be struggling with stress and anxiety, maybe having a challenge to their level of resilience for that stress. Then that enables us to be able to identify that the pet may need help. But one of the things that I wanted to highlight for you today is that what we've been able to do over recent years is really understand how the stages of brain development are different. So a puppy's brain is very different in how it processes the world to how an adolescent's brain processes the world, for instance. And you may well have seen that even without realizing it, in that puppies tend to be very positive, very optimistic. They throw themselves into situations. They can often appear to be really resilient during puppyhood and enjoy playing with other individuals in the park, for instance, and be able to get into a routine at home very easily, and appear to be settling in very well. Now, there are several changes that happen as the puppy goes into adolescence, and those changes actually change the structure and the function of that puppy's brain. And the adolescent brain can be much more sensitive to changes in the environment that it might perceive as punishing or not fun. It can be much more sensitive to changes in routine, for instance. and much less optimistic and slightly more pessimistic about the world around them. Now, those changes make sense from a neurobiological perspective because the adolescent is going out into the world and finding their way as an individual. So they have to be very careful about how they're processing the environment around them. And they have to ensure that their brain is developing in a way that's going to keep them safe. So they have to be sensitive to what might be threatening in the environment. But the challenge for us as pet parents is that it can appear that our individual puppy, who was full of the joys of spring, has now gone into adolescence and has suddenly become quite fearful. And whereas they used to throw themselves into playing in the park with other people's dogs, they're now going into the park and perhaps being a little bit spooked and a little bit unsure. And this brings us right back to the beginning of what I was talking about, which is that it's really important that we have that understanding early on that we can help them by providing different exercises that we can do with them, and providing different lifestyle choices that can help to build resilience. And it's really important to focus on that as the puppy's going through adolescence. So it's not the case that we do all the socialization during puppyhood and we don't need to do any of that during adolescence. And actually, it's just as important to focus on that resilience conditioning, if not more so, during adolescence, because even though the puppy has experienced all that training, experienced all those life experiences during puppyhood, it's really helpful to think of it as their brain has now changed. And what we now need to do is have the new adolescent brain re-experience the environment and re-experience those life experiences. So we can't take our focus off how important that socialization, that environmental experience, exploration, positive experiences, positive reinforcement training is during that period of adolescence. And it's interesting to see that in the human literature, we see a lot of mental health challenges are rooted in adolescence. So even though they may be expressed in adulthood, they have their root in adolescence. And the canine literature is also mirroring this. So that might be a good point in time to look at some of the questions that you guys have been asking and seeing how they might fit into this conversation of resilience. So here's a fantastic question. Can you explain the importance of early intervention in addressing pet behavioural problems? And I really cannot stress enough how important early intervention is. Now, the type of intervention may look very different, and it may look very different dependent on a number of factors, such as what the behavioural problem is, perhaps how intense the behavioural problem is, and whether we think there are issues in terms of the individual pet's well-being and their safety, and also the safety and well-being of those people and pets that live in the household. But it's really the case that early intervention, as opposed to waiting and seeing what happens, is hugely beneficial. And from a neurobiological perspective, that's because as the pet develops behavioral problems, whether that might be a cat in the house that is marking, so urine spraying in the house, perhaps because of the stress of the change of routine as we go back to work, and maybe they're feeling a bit lonely or anxious about the fact that we're not all, around all of the time, that urine spraying and marking can start off as a response to stress and as a response to anxiety. But the longer it goes on, it can actually then become much more complicated, with elements of learning that get woven into that stress response and elements of habit that get woven into that stress response. And with the example of, for instance, urine spraying or urine marking, there are also odor cues around the house that cue the pet perhaps to continue to spray in that particular area or continue to mark in that particular area. And so very quickly, behavioral problems can start out as one thing, but then start becoming much more complex and having lots of different elements involved in them, that if we leave intervention until much further down the line, we then have to kind of pick those different factors apart and start approaching the behavior problem from lots of different angles. Now, in addition, there's another layer there, which is that as pet behavioral problems continue, the brain actually changes in terms of not only the way that it functions because of that behavioral problem, but also the way it's structured. And we often don't think about the fact that the brain structure changes when pet behavior problems develop. But actually, those structural changes can start to happen within seconds and minutes of behaviors. But then as those behaviors become repeated and more ingrained and more habitual within the lifestyle, and more long term, those structural changes become more entrenched, if you like. And not only do the individual neurons start changing in the shape and the branching and the connections, but actually individual brain areas change the way that they communicate together. And so that again creates this complexity with behavioral problems that is only ever going to get more complex and more difficult to, if you like, unpick and be able to treat or find supportive care for later on. So early intervention is really the key. And Dr. C, you're going to hear in Dr. C's section that she's going to talk about different ways in which you can get help, and how that early intervention may look different depending on what your particular situation is. Okay, so here's another question. Are there preventative measures like food or lifestyle adjustments that pet owners can make to promote overall brain health for their pets? And this is one of the reasons why at Behaviour Vets we developed this framework for resilience conditioning, or what we're calling resilience conditioning. And resilience conditioning is exercises and different things that we can do, lifestyle changes that we can make for our pets that actually help to build resilience. So what do I mean by help to build resilience? Because doesn't that mean that we, build resilience in humans, for instance, by, having conversations that help us to feel more confident in life? And we can't do that with our pets, right? But actually, no, building resilience is a neurobiological change. So there are lots of different neurobiological changes that happen within the brain and also the body when we partake in exercises that build resilience. And that might be as simple as taking a dog regularly out into nature to have a nature walk. But that nature walk creates a sense of relaxation, providing that the individual dog doesn't have a fear of the outside. So we have to remember it has to be individualized for the individual dog. But if the dog enjoys being out in nature and can relax and wander along, sniffing along the ground and sniffing through the undergrowth, etc., using olfaction, remember that dogs use scent and olfaction a lot, so that's their ability to smell things. And we know from various studies that have been done that those walks in nature and that prolonged sniffing that dogs can engage in when they go on walks in nature actually has the effect of reducing the adrenaline and cortisol levels in the body, so that it brings about a sense of calm and reduces stress. So that would be one example where we're helping to introduce an exercise into the dog's lifestyle that can have the impact of creating that sense of calm and reducing stress, and at the same time can help to build resilience. Because what that's doing is changing the levels of neurotransmitters, so these biological chemicals that help within the brain to for different brain areas to communicate with each other and for brain function to be healthy. And that can help to rebalance those neurotransmitters and help the individual to be able to cope with stress. Now, there are lots of, if you look at the resilience framework that we created, we've got 7 different domains there, and we can look at those different domains. They might be mental and physical well-being. So that could be lifestyle adjustments that enable an individual to cope with pre-existing diseases, or indeed to cope with pain. And we hear some of those from Dr. Jurney about that interaction between mental health and physical health, if you like, but also about putting in appropriate nutrition, making sure that we've got enough omega-3 in there so that we're getting enough nutrition to those brain cells and helping to promote good cognitive function and brain health, etc. So there are lots of preventative measures that we can put in. And essentially for us at Behaviour Vets, we found that one simple way to be able to bring all of those together under one umbrella was to look at them under the resilience framework, because that helps us to think about all the different domains that are involved in building resilience, and we can think about what measures we can put in and lifestyle adjustments we can put in for each of those domains. Okay, so we have a question here about what education do we have for pet owners about reactive dogs and what might drive that behaviour? So this is a really, really interesting question. And actually, I have personal experience of ownership of dogs who have reactivity problems. And it can be extremely stressful because if you're living with a dog that has reactivity, which we would usually think of in terms of when you take the dog out on a walk, it might lunge on the lead or bark at people, or it might growl and bark at maybe cars going past, or skateboards or bicycles, etc. It can be really stressful walking a dog who has those reactivity problems. And it's stressful not only because you have to manage the dog, and if they're large, there might be a physical component to that. I tend to have large dogs, so if you're trying to manage a reactive Rottweiler, you need to have very strong muscles to be able to do that safely. And you need to be hyper vigilant, so you need to be constantly watching out a mile in advance about whether there's a stranger coming or whether there's a dog off the lead, etc. And it can make you quite anxious, even if you weren't an anxious person before. But also it's stressful because you're mindful of what people think of you, and also of where you can walk with a pet like that. So I really, really have empathy for those of you who are out there dealing with reactive dogs. And it can be sometimes difficult in terms of what drives that behaviour to try and understand how best to support those dogs. Should we completely avoid those situations where they're triggered, or should actually we have them in those environments sometimes so that they can learn to be able to cope with those environments better? And the key here is really being able to tell what's at the root of those behaviours. So is it that we have aggression in some way? So we have, for instance, human-directed aggression or dog-directed aggression. Is it that we have frustration? Is it social frustration? For instance, do we have a dog that desperately wants to have those social interactions and is frustrated by the fact that they're on a lead and they want to get close, but perhaps doesn't have the social skills or the social flexibility to be able to deal with social situations appropriately when they are off the lead? And so that can be very conflicting and very confusing, both for the pet parent, so for us as pet parents, but also for the individual dog. Is it fear-based? So actually, does the dog have some fear associated with social interactions, or fear of, for instance, fast-moving objects like cars or skateboards or bicycles? Is it that they're very excited by those things? So is it just an excitable, playful reaction that they haven't quite got the social skills to be able to keep under control? And so therefore their reaction, it may be appropriate in terms of the emotion that they have, in terms of being excited and full of fun, but it's just disproportional in that they don't quite have that refinement over those interactions. And so it's sort of expressed in a way that isn't appropriate in those situations. Now, if we can't identify that for ourselves, that's one of those examples where it's really important to reach out to a professional who can help us identify what might be at the root of those behaviours for the individual and can help us with an appropriate training plan. And we can utilise the resilience framework to help plan an individual support care plan for that dog in that situation. But there may also be other methods that a professional can utilise to be able to help us with that. So if we're having trouble trying to decide what's driving that behavior, then that's one example where early intervention is really, really beneficial. Reach out, get help. There's lots of help available. Make sure it's from somebody who uses kind methods and who can support you with that understanding of what the individual needs. That will help you decide whether we should be avoiding those situations or whether we should be helping to build resilience in other ways so that that individual dog can cope with those situations better. Okay, thank you very much. And I will hand over to Dr. C, who will pick it up from here.
Hi, everyone. My name is Dr. Elise Christensen, and I'm a board-certified veterinary behaviorist through the American College of Veterinary Behaviorists. There are actually fewer than, I think, around 125 veterinary behaviorists in the US. And I'd love to tell you just a little bit about what we do, because many people don't even know we exist. That way you'll have an idea of where I'm coming from when I'm answering some of the great questions we received today. So as a student, when I was in elementary school, like many veterinarians, I wanted to be a veterinarian basically from the day I can remember knowing that veterinarians existed. But I decided when I was around 16, in fact, I can remember the exact day, I decided to become a veterinary behaviorist. And so I went to school to become a veterinary behaviorist. And the reason is because veterinary behaviorists are uniquely situated because of their education to help families that really want to enrich and maintain the human-animal bond, as well as to help protect and ensure public safety around animals. We also get the advantage of understanding underlying medical problems that either contribute to or may actually even cause some of the signs that our families might complain about with their animals. So as a veterinary behaviorist, my training in ethology, which is the science of studying how animals behave in their natural environment, along with psychiatry, both veterinary psychiatry and human psychiatry, understanding surgery, internal medicine, dermatology, etc., in veterinary medicine, and understanding the way animals learn as well as their neurobiology allows a veterinary behaviorist to really get into the dark, deep depths of why we see some of these signs, while also creating plans that can help support the human-animal bond that are able to be implemented by folks at home. Because one of the things that people really get concerned about when they're thinking about changing behaviors in their animals is, do I really have time? Because when I grew up in the 80s, training a dog, basically you were said, like, make sure you plan 20 to 30 minutes every day, do a whole session. That's how you're going to teach your animal a new way to respond. And the reality of it is, that can be great for some animals, but for most families and for many of our patients at behavior vets, they work better throughout the day and in small chunks. And that makes sense because a lot of our patients do seem to be having underlying fear and anxiety about the triggers that are just part of what we think of as normal human life. And this means that we are better off helping that animal learn about what behaviors are really great and reinforced by us on purpose, not on accident, throughout the day, because now we're intervening in that patient's neurobiology multiple times and giving it the practice it needs to change its structure versus setting up, 10 minutes here and there. And it just turns out that most people are far more likely to do training that goes on throughout the day versus setting aside a certain amount of time. For instance, my own pup, I'm working with him on his cooperative care, which is something we really focus on at Behavior Vets, helping families get the veterinary care their animals need, but in a way that's kind to their animals and helps them continue to get veterinary care over the course of their lives. Because we know when we push fearful animals at the veterinary clinic, we can actually cause them to have behavioral decompensations, such as increasing aggression to strangers, because they may have had a scary event at the veterinary clinic, which is often with strangers, right? And also, when they have a scary event there, they often have more and more fear, anxiety, and stress as they get additional care. So when I work with my dog on this, I work with him about 2 to 3 minutes a day in the midst of giving him his regular supplements and meals. I don't set up a separate session for it because I don't have time. I'm a working mom. Dr. Murphy and I are riding herd on BehaviorVets, which is a pretty big company in behavior land. So we want, just like most of our families, to put these things in the midst of our days. So as a veterinary behaviorist, I get to do all of those things and sort of be the Captain Kirk on the ship of behavioral healing for families that are working with their pets with us one-to-one. And I also get the opportunity to help support other specialists and general practitioners, as well as behavior consultants, trainers, rescues, shelters, etc., to help make sure that they are providing the best welfare and have up-to-date scientific information that can impact their plans, because not everybody can come and see a veterinary behaviorist. If you are wondering about behavior in your pets, there's lots of ways you can get additional help, both from your primary care vet and even DIYing things online. So we put together a little slide so you'd have some access to these different resources. One is the American Society of Veterinary Animal Behavior. Am I getting that right? American Veterinary Society of Animal Behavior. There we go. It's almost like I don't say this every day for the last 30 years. But at any rate, that is a great website for position statements, how to find an amazing dog trainer, what kind of training you should be looking for, what is cooperative care. So you can find a lot of great information there. We also have a link to the American College of Veterinary Behaviorists. There you'll find excellent webinars and additional information on how to care for veterinary patients if you're a veterinarian and interested in behavior. And if you are a regular person or a dog trainer or animal behavior professional, the webinars are really, really great. They're focused mostly towards veterinarians, but I think anybody can jump into them and get a lot of really rich information. The other place you can check out is Fear Free, which is Fear Free Happy Homes, is the sort of general family link to that. You can find locators for groomers that are dedicated to low stress handling, kind handling, veterinarians, technicians, trainers, all different types of providers, as well as really great infographics and videos on specific behavioral disorders that you may be working on at home. So if you want information about how to help your pet through something, or if you're just looking for more information on what does it mean to be a dog or a cat, for instance, and how can I help my animal at home? Those are some great resources there. And then, of course, at BehaviorVets, we have tons of free webinars for people that are either veterinarians, families that are managing animals, rescue, et cetera, to dive into behavior in a little bit more detail. And then if you really want to go in depth, we have paid webinars too. So we can use all of these resources along with virtual services that many veterinary behaviorists, behavior vets included, provide, and virtual training, which can be super successful, even though for those people that are kind of working from home and want to work on things in their home. And I think that's one of the things that's really coming up right now for families is this concern about many people are going back to work and maybe going back to work more days than ever before. So I'm really excited today to have some excellent audience questions on animal behavior. I mean, to be honest, I could probably do veterinary and animal behavior questions all day long, but I'll try to get you some really meaty stuff to get you going for the rest of your day. The first question that we received was, can we discuss the underlying cause of separation anxiety in pets and strategies for managing and treating it? And there was a second question that kind of plays into this as well about a Schnauzer who is having trouble with attacking people when they leave. The first thing I'd like to say about this is this Schnauzer may or may not have separation anxiety. There are a lot of reasons why animals may bark or growl when people leave. One of them is separation-related distress of some type, but others have just learned to do this behavior, especially with visitors. Some pups who are fearful of visitors, when the visitor is kind of looking at them, they're too inhibited to show the behaviors that they maybe really want to show, which is, please get out of my house, and you're not listening to any of my non-aggressive warnings. And then as soon as the person turns their back, growling, snarling, snapping happens, right? And especially if the person is going towards the door, what accidentally happens is that the dog is reinforced for the behavior if the goal was to get the people out of the house. So the dog doesn't necessarily know the person was leaving anyway. They just know that they did a thing, and then the trigger they were trying to get rid of left. Now, I don't recommend that you keep the person there while your dog is aggressive to them, for instance, so that your dog can learn that people don't leave. That would be very unsafe. And that's not a place where we train from a psychological standpoint for all the reasons that you heard from Dr. Murphy. We don't want to continue practice of these behaviors. We want to give the animal more coping strategies to build systems and accommodations around them so that they have an improved likelihood of success. And then we want to help change their behaviors. So just keep that in mind, as even though we're talking about separation anxiety and this little pup who barks at people when they leave, that's not the only reason they might do that. Now, separation anxiety itself is a cluster of symptoms and kind of a label for a variety of different signs that encompass things like vocalization when left alone or when the animal feels alone. For instance, they can't get to the owner's in another room. They are maybe urinating or defecating at home, some vomit or have diarrhea because they're so panicked. They may also have hiding behaviors and just withdrawal. And those pups, I don't think we know much about because those signs don't bother most owners, right? Some dogs won't eat when they're home alone. Some don't drink when they're home alone. And many will do some destructive behaviors as well. There are a lot of different signs that an animal is very uncomfortable being left alone. And in that case, there are a variety of different treatment options. Everything from, traditional training to help teach the animal to be more comfortable being alone, building accommodations around them like resilience conditioning, helping them learn that they can weather these storms and get their brain back to a healthy baseline. And even providing medications or supplements to help decrease anxiety, because many dogs that have separation anxiety that rises to the level of concern with their family are probably suffering significantly whenever they are left alone. And even though it doesn't really make that much sense to us, and many people are tempted to think that, oh, my dog is just, bad when I'm gone. I think we really need to admit that some of these dogs are suffering all day every time they're home alone, and they really deserve treatment. If you are afraid of spiders and somebody locked you in a spider every day, a spider closet every 8 hours, for several minutes at a time or even hours at a time, you probably decompensate pretty quickly, not want to go in there, not be left alone, and panic when you are there. So those are the things we think about for separation anxiety. But many behaviors that are consistent with separation anxiety may also be for happening because dogs are underenriched. They haven't had adequate exercise. They don't have enough to do with their brains. So if your animal is already showing signs of separation anxiety and you're planning to head back to work, the things that I would recommend that you do are create predictability and social structure. So what I mean by that is have your environment and your routine be relatively predictable. Now, that doesn't mean do everything at 8 a.m. and then 8:15 and then 8:22 and 30 seconds level of predictability, but a generally predictable flow to the day is really helpful for these dogs and for animals that have anxiety disorders overall. The other thing we want to help them with is to have the opportunity to engage in choice and enrichment and to experience agency, that they get to do things that they enjoy doing and they have the opportunity to say no, and we honor that. So for dogs who want to be touched, we're going to be counseling owners on, hey, your dog likes to be petted, but let me show you where he wants to be petted on his body and when. Because a lot of pets, just like a lot of people, don't want highly intimate touch every moment of every day. If a quarterback is making a touchdown, that's not a great time for a giant hug, right? Until it's over, right? That would interrupt their flow. And we see that with a lot of our patients as well, that during training, a lot of them don't want to be touched. They want to keep their working going. And during rest time, they may be really interested in being petted, but only in certain places and sometimes only for a short amount of time. So we're really looking to help families identify their individual animals' needs and provide them proactively rather than just reacting to the fact that an absence is going to happen. We have a really great webinar on creating structure and routine and enrichment for animals, for families that are going back to work. It's focused on dogs, but you could use it for cats too. And it's called Homebound Hounds. We used it right in the beginning of COVID when people were coming home and working from home. But the reality of it is that all of those techniques are great for people who are working from home now and planning to transition out. We also have a question here about a 13-year-old dog who's always lived in the same home, but is going to have to be relocated for several months during a renovation. And the question is, how can we help him feel comfortable in the new space? I think this is a wonderful question because like many older people, our older pets can struggle with change a little bit more than some of our younger ones. And they also may have sensory decline that we are not aware of until we change their environment. So if we are going to moving an animal into a new environment and that animal is a dog, ideally, we have them have the opportunity to investigate that environment without staying there before we kind of wholesale move everybody over. If we don't have that opportunity, and a lot of times we don't, that's okay. But if you do, take advantage of it. Other things to keep in mind is choose the second location with your animal in mind. And the other thing to keep in mind is that since we don't always know whether an animal is experiencing sensory decline, if you have time ahead, you could actually help them learn about the environment through some slightly stronger scents, for instance. So I would say we always want to be a little cautious when we're using scents with dogs because their olfaction is so exquisitely sensitive that, I mean, I don't think we know, but you could give them a headache with some of these essential oils and things like that. But what I would say is that for our pups with maybe visual deficits and things that we don't maybe identify completely, one option is to put specific scents around areas that are unsafe and other scents around areas that are safe. And then when you go to your new location, you can use those scents to help guide your dog about the location so that they can know, like, hey, you know, when I smell cinnamon, that's I'm about to run into the couch kind of thing. So that can transfer to your environment in a slightly different way than, you know, other olfactory cues might, because you've kind of prepped them ahead of time. Then create your routines in your current home, transition them to the new home, and of course, take familiar scents and things with you as well. So bedding and you, I think, are probably the most important thing, because most dogs are more bonded to their family members than they are to a location. We have some other questions about destructive behavior in dogs. And the question was, how do you manage destructive behaviors or even things like digging? Destruction and digging, even though they are both destructive, they're not the same thing. Digging is a normal dog behavior. And also, destruction is also a normal dog behavior to a certain extent as well. But digging is very normal. And some dogs are super fans of digging. It's like, you know, if you're a jogger or a runner, you know, right? Like you could break your hip and you would still go running. Same for these pups. They're very driven towards this normal dog behavior. It's super fun for them. And it's just disruptive for us as people. It's what typically would be classed, by me at least, as an unruly behavior. That means a normal species-specific behavior for a dog that people don't like, right? So what we do in those situations where we have unruly behaviors that may be part of the animal's natural behavioral repertoire is we really try to target them to areas that we can all be comfortable with. Because if you try to just put the kibosh on digging, I mean, okay, go for it. But these dogs have a need to do something. If we don't provide them with an opportunity to do a healthy behavior, you could have them psychologically decompensate because we're just not giving them the access to coping strategies and lifestyles that is healthy for their individual brain. So for a dog who's digging a lot of places, what we might say is, okay, we are going to avoid free access to places where this dog digs. We are going to give them tons of access, supervised access, to areas where we love this animal to dig. And we might make it even super fun to dig in these areas, like getting a pool, a baby pool, and putting dirt or sand in it, wood chips if your dog doesn't eat them, and then putting all sorts of food puzzles or little treats in there, again, assuming your dog doesn't eat non-food items, right? And giving them the opportunity and reinforcing them for digging so that they have a place that is fun to dig and they're not getting punished for doing this totally normal behavior. And they're also not having this behavior taken away from them because it's something that's clearly very important and reinforcing for them, or they wouldn't keep doing it over and over. And that is the case for destructive behaviors overall when they're not related to fear, anxiety, or stress. Animals, depending on their species, have different types of destructive behaviors. And to be honest, if I could talk with a cat who is, kicking cat litter all over the bathroom and doing what an owner might find disruptive or destructive, that cat would say that's just normal cat behavior. When I pee or poop in the litter box, I kick stuff everywhere. And if I were out and about, nobody would even care, right? So we're going to go back to those situations and say, okay, that's a normal behavior. Destructive behavior can be completely normal. We just need to find a way to target it or manage it. Now, for those pups who are ripping up things when owners are gone or during a storm would be another classic time for destructive behavior. In fact, one of the animals I know from my past wasn't my pet, but a friend's pet, is one of the reasons I became a veterinary behaviorist, because he was so destructive during storm phobia, the family actually had to remove them from their lives. And it was so heartbreaking. They loved that dog, but he was eating through the walls during storms. And we lived in Iowa. There's lots of storms there. So what I think we really need to focus on for dogs that are having significant destructive behavior, or even behavior that, maybe I wouldn't be bothered by, but the family is bothered by, is giving the animal something safe to destroy, because it's clearly a coping strategy for some of these animals. Keeping in mind that some destructive behavior is not because it's a coping strategy, it's because they're trying to escape with their destructive behavior. They're attacking windows or doors, things like that. Then we know we have a problem with that animal in that environment. And until we can help the animal learn to be more comfortable there, we should proactively use medications or supplements to help them not panic as much, because we don't want their brains to practice this anxiety and panic behavior. We don't want them to suffer to the point where they feel like they need to break their toenails and their teeth, breaking out of a crate or out of a door. So we'll do that in the short term so that they can be relaxed and more comfortable overall, not practice the behavior. And then we'll work on how can we help this pup learn outside of the trigger situation how to be more comfortable. How can we relieve underlying stress, panic, fear, phobia that might be causing them? And how can we meet normal species specific needs that might be causing them? And another question we got was, how can positive reinforcement training help decrease behaviors we don't want to see and reinforce the behaviors we do want? Well, there's lots of ways that we can do that with positive reinforcement training. It's kind of a myth that, any breed needs a strong hand, or some behaviors have to be taught with punishers, like a recall, for instance. I'm not aware of any literature that suggests that getting your dog to come when called is faster or more reliable using punishers versus positive reinforcement. The next thing we're going to do is we are going to space out throughout the day tons of reinforcers for all the behaviors that are happening second by second by second that we like, but we never do anything with because they're boring and they don't catch our attention. So a dog that's playing by himself, a dog that's resting by your side, a dog that's looking quietly out the window, those are all behaviors that are highly reinforceable, either with quiet, affectionate tones, a tiny, somewhat boring treat, or the availability of a toy that maybe they didn't have before that you could quietly give to them. So we are looking to reinforce multiple behaviors throughout the day. And, we usually give our clients a round number of approximately 50. I wouldn't say that's necessarily a scientific number. The goal is just to say it should be a lot, because if all you do is focus on the behaviors you don't want, it's very frustrating for families and the dogs. You can also do this with cats, any other species, husbands, kids. Looking for behaviors that you want and reinforcing them proactively is, even if that's all you do, could help shift behaviors just with that. And it takes about 3 minutes total throughout the day, especially if you put your reinforcers around, or if you're going to use quiet verbal reinforcement. The other way that we use this is we then proactively teach the animal new coping strategies outside of the trigger situation, so that when we get to a tricky situation, the animal already is able to do a behavior that is more comfortable for everybody, and the animal has a plan, and so does the handler, right? So for instance, a dog who has problems with barking and lunging on walks, sure, you can work on walks, you can reinforce behaviors you want to see on walks, you could do it really proactively, you can reinforce them tons of times, give 20, 50, 200 reinforcers on walks, go for it, and practice those walking skills in a quiet environment with your tools on, where the handler doesn't have to worry about the environment and neither does the animal, so that we have the best chance of them learning how to do the things that you want to do in the stressful situation with an emotional state that is calm and having a good time. Because if we don't do that, it could be a much harder go to get control of behavior on walks. The animal is learning in a situation of stress, and we all know that's not where the best learning happens. So no matter what the problem, generally we're going to be looking to increase enrichment, increase agency, coach families on species-specific body language and their own animal's desires, what is comfortable for their animal, and assess their family system and what they can do. we're going to assess underlying medical problems, and then we're going to create specific plans that are combined with avoidance to change the animal's response to those trigger situations. And all of that is done using non-confrontational, fun games, because behavior modification, even though it might be for something super serious that makes you really stressed out and even really stresses out your animal, can still be joyful. And when it is, you're going to be more likely to do it. And just having those positive emotions while you're doing your management strategies and your training is part of healing for these animals and their families, because a lot of them have had repetitive exposures together that have been incredibly stressful and very hard to kind of process. So going backwards to go forwards is the way that we really want to think about these kiddos.
So really want to say thanks to all of our panelists for all that expert advice. I know everyone's going to find it really, really helpful, but what happens when things go away from behavior and a little bit more to the medical and therapeutic? I think those are really interesting questions where the rubber hits the road. So let's do a quick round robin with our panelists. Let's start with you, Dr. Jurney. When should a pet parent consider moving beyond behavioral intervention into medical intervention?
I think that's a really great question. I think it depends on the severity of what we're seeing, right? I think certainly for a lot of pets, there are some great behavioral resources out there, and we should start there, right? Oftentimes, training, small changes in environment can make a huge, huge impact, and then we don't need to go to medications. But for some pets, if the behavior things are showing us are severe enough, sometimes we actually need to get some vets on board to get the pet in a calm place where we can then start to do training. And there's no shame in that, right? Steve knows that I adopted a dog during the pandemic who had a lot of behavioral problems. And he is a dog that, despite having 2 degrees and advanced degrees in animal behavior related subjects, I needed help with him, right? And so, not only do we do twice daily training, but he's also on medication because that allows me to do those interventions in a way that's more meaningful for him. So I would say, I hate to always just say, go back to your veterinary team, but every case is special and every case is individual. And your veterinary team is going to be a great resource for you in figuring out when you need to do more stuff.
Thanks for that, Dr. Jurney. That's great advice. Dr. Murphy, how could medications potentially affect a pet's brain and behavior?
So medications can affect pets' brain and behavior in a number of different ways. So all the way from changing the way the receptors on individual neurons are actually functioning, right the way up to how the networks of neurons are communicating with each other to help facilitate behavior and emotionality. So both in terms of what the pet is thinking and how they're thinking about a situation, but also importantly, what they're feeling and how they're feeling about a situation. So yeah, there are lots of different ways that medication can affect a pet's behavior. And that's one of the reasons why we have veterinary behaviorists like Dr. C, is because it's very complicated. There are lots of different medications and they each have lots of different actions and ways of working.
Yeah, and we even have literature suggesting that, I think you mentioned this earlier, Dr. Murphy, that medication like, for instance, fluoxetine can increase optimistic bias in some of our patients. And I think that's so cool because if we could help our patients be a little bit less the sky is falling and a little bit more treats rain from the sky, so to speak, I think that we would have a lot fewer behavior problems. So I think it's really great that we have the opportunity to use medications, and the trick with them and with families and other veterinarians is just reminding them that the vast majority of behavior medications are incredibly safe, even compared to some of very common medications used in veterinary medicine, totally, like steroids or non-steroidals, for instance. Great medications, totally needed. You should definitely use them if your pup needs them, but they're not as safe as the typical medications used for behavior. And a lot of people think that when we use medications for behavior that we are trying to chemically restrain their animal. And the reality of it is that for a daily behavior problem, generalized anxiety disorder, things like that, we're looking for and can attain side effect-free behavioral improvement. So using a medication doesn't mean that you're doomed to having a dog who's a zombie. In fact, if we have a patient at Behavior Vets and the clients are saying, oh, he's just like really lethargic, well, that's a problem. And we're going to be moving on to find out, do we need to adjust our dose? Do we need to adjust our timing? What else is going on with the animal medically, that kind of thing. So we have the opportunity now more than we've ever had before, because we have so many things available now compared to when I first got into behavior in the, I guess the late 90s, that it's a very exciting time to be a veterinary behaviorist and to be able to utilize these additional supports for our pets whose families are having to make a ton of accommodations throughout their lives to help the pet feel good enough to be part of a human family.
Thanks both. Appreciate that. Specific to you, Dr. Christensen, are there any suggested remedies pet owners can pursue to address common behavioral concerns like anxiety? That was a rather frequent question we got.
There are a ton of supplements on the market, and some of them can be helpful for certain pets. I think it's always really important to circle back with your veterinarian, even if it's an over-the-counter supplement, because even though we call them supplements, it's important to remember that they may very well be bioactive and have drug interactions or be inappropriate for underlying medical problems that your individual pet has. So please don't be fooled by the idea that since it's not FDA controlled and it's not a prescription, that it is necessarily safe for your pet. Also keep in mind that supplements can be less controlled for consistency, and that can be a real problem for pets with behavioral disorders. So the first stop should be your veterinarian, even if you're looking at over-the-counter supplements. But yes, there are a number of supplements that can be helpful for pets with behavioral disorders, and how you choose them is dependent on their mechanisms of action. So that's why you should talk with your veterinarian before you start, because some supplements that say they're calming or for behavior may not be appropriate for your animal's symptoms.
Excellent. Really, really good information. Well, we could probably do this for hours and hours on end, and we'll do the best we can to get to any further questions in the chat. But our time is up for today. So thank you so much to all of our amazing panelists, and thank you for those who are joining live and who will join again later on. Hope we gave you some good information today that you can do something with, and we'll see you next time.